IC Tomorrow is looking to fund 5 companies to develop new digital prototypes that will be trialled with the Clinical Excellence Challenge partners. Welcome to the Technology Strategy Board's IC Tomorrow Digital Innovation Contest in Clinical Excellence. IC Tomorrow is investing £144,000 in order to encourage digital innovation in the healthcare sector. We're looking at 2 themes for this contest. Theme number 1 is around supporting healthcare professionals, and theme number 2 is actually around patients.
If you think about how your relationship with your bank manager has changed in the last 10 to 15 years, compare that with the way that your relationship with the health service, with your doctor, actually hasn't changed significantly. It's clear that the healthcare sector generally, both in the private and the public sector, has been very slow to respond to the challenge of digital.
What we need are a new generation of products and services delivered for our mobile phones, our apps, our wireless devices, our embedded devices, our computers, which bring the best of creativity and digital technology in terms of diagnosing, managing and delivering health services.
Creative businesses have an enormous amount to bring to the sector. They have skills in user-centered design, which is absolutely fundamental. They have skills in things like game design. You're looking at trying to persuade people to change their behaviour. The whole kind of serious games movement has a lot to offer in that space. In terms of data visualization, in terms of creating compelling experiences across screens, there is no end, I think, to the opportunities that are available for digital agencies to engage with healthcare service providers in the public and the private sector.
This is a sector of the economy that's worth something like £130 billion, almost 10% of the national economy. In fact, on some measures, it's actually the single biggest sector in our economy. And what we know is it's growing fast and is only going to get bigger. If you can develop a new product, a new app, a new interface, working with a medical technology company here that solves a proven clinical need here, there is every opportunity in the world for that pioneering work to then be delivered and to be sold to markets across North America, across India, across all the markets in the world in which healthcare, as with here, is expanding rapidly.
This is a completely open competition. We're really keen to get creative digital companies applying. You don't have to have a background in health or an existing product. What we're really looking for is really innovative, creative ideas that help to solve the challenges that we've set. Challenge 1. We're really interested in companies that are good at social media. Maybe you can have behavioural analytics in there, or perhaps you can provide a platform for sharing ideas. Can you actually promote a culture of openness and collaboration? If you can do this, this challenge is the one for you. Challenge 2. Whatever your tool set, you will need to bring your user-centric skills, and with support from the BMJ as well as the Open Data Institute, we would like to see solutions that really truly merges formal data with informal or experiential data. Challenge 3. How would you design a user experience so that a doctor could look at UK best practice along with local crowdsourced and curated content? What we want to make sure happens is that we can reuse information and make sure that it's locally relevant, it has a local flavour. Challenge 4. Let's face it, when we go to the doctors, often the pamphlets and the information that's there is very dry. And although it may be written in plain English, often if you have a reading age of say 10 or you don't speak English very well, they're not very easy to understand. So we're looking for tools and designs that bring information to life. Perhaps you're a mobile app developer or an innovative digital publisher, or you develop serious games for behavioural change. We're looking for solutions that are really imaginative and actually take information and make it stand out, make it much more engaging. Challenge 5. Are you a games developer? Do you have experience in developing tools that encourage behavioural change? We're looking for fun, engaging solutions that can be used to drive better patient health behaviour and improve personal health knowledge. Applying is really simple. It's a 2-minute video. It doesn't have to have high production value at all. You could just be a piece talking to camera. The important thing is to get your story, get your ideas across in the 2 minutes. Describe to us how your digital solution, your idea, is helping to solve this challenge, or how working with a partner is actually going to kind of enhance that process.
What the IC Tomorrow project gave us was the opportunity to step outside of that comfort zone and work with the cultural sector, who we didn't know, we'd never worked in that space before. And the beautiful thing about that was they had education officers, they had communications and engagement professionals now talking to us, looking at the value that our technology represented to them. And that was an absolute eye-opener for us, because we hadn't previously considered it before actually taking on the IC Tomorrow challenge. The feedback we get from a different type of professional actually helps us move our technology forward into a space that makes it more wide-ranging, more valuable, and more adoptable by other professionals. The great thing about the video is that you get to practice telling a story about your idea or your technology, which then can inform the pitch. I think the key thing about doing these applications is don't just do them by yourself. Actually throw the ideas around with your friends, family or colleagues at work, and try out a few different ways of telling the story in a succinct way.